Hi, everybody. We want to welcome you in on this Monday to Coronavirus Inside the Arizona Numbers, where we track all the numbers and data across Arizona to help you make the best decisions for your life and your family. I'm Katie Rammel. Alongside me here, our data guru, Garrett Archer, who always helps us dive deep into these numbers. Some lots to talk about, first of all, on this Monday. Usually Mondays are a little bit quieter as far as the numbers themselves go, which it was the case here, but we have a lot to talk about. Over the weekend in Arizona, we passed more than 1 million tests taken out there. That was a big number. Also, we passed more than 14 million cases, positive tests across the U.S. So rather Earth. Let me correct that there. The U.S. is about at 3 million. So 14 million in the U.S. It's a Monday. It sure is, Garrett. So let's start off where we always like to help people understand the summary page on the Arizona Department of Health site. A lot of people that we've talked to on here have now gotten used to hopping on there as well in the mornings. The data is updated every morning. Weekends no different. And Mondays are usually a little bit lower in the reporting numbers. What did you see today, Garrett?
Yeah, so here we are at the AZDHS summary page where we start every morning, as you just said. We have cases reported today, 1,559. We do have a number of tests reported, 8,477. You see, we did pass a milestone today of over 1 million tests have now been done in Arizona, but I do want to put a little note on that. That's 1 million of both the combination of diagnostic tests and antibody tests. So this is where we look for there. 793,000 PCR diagnostic tests and 210,000 antibody tests. This percent positive for today was about 21%, which is fairly good compared to where we were. And then the number of deaths that we reported today were 23. But of course, as we've talked before, especially deaths, Mondays typically impact death reporting more severely than it does any of the other metrics, and we will likely not see. This is going to be a fairly low number for what we might be expecting. For the next couple of days.
Let's talk about the weekend too, and as we get ready to talk about that, I just want to recognize Deanne just posting that she lost a friend today. So Deanne, I'm so sorry, first of all, for your loss. And that's exactly why Garrett and I spend time on here each day explaining the numbers to everybody so that they can make the best choices for their lives to protect themselves. So I just wanted to pause and say we recognize your friend, and we recognize all of those lives lost here in Arizona. Almost 20 or more than 2,700 people, 2,784 people already lost in Arizona. So Deanne, thanks for joining us on here today. Okay, so Garrett, as far as those numbers go, Saturday was a pretty high number. I sort of prepare myself before I look at that on the weekends on Saturday, and boy, it really was a higher number. Sunday, a little bit lower. So it was sort of as things were expected, but still Saturday was a big one.
Yes, Saturday was 147 deaths were reported on Saturday. That's by far the highest death number we've ever reported in a 24-hour period. To just put that in, I just want to put a little note on that. That is reported to the AZDHS in a 24-hour period, not occurred in a 24-hour period. So 147 people did not die on Saturday or in the days prior. It was actually, especially for this one, something was done which is called certificate matching. They basically went out looking, they did a query on computer systems looking for certificates, death certificates that would have matched what they had in their records, and they came back with about 147. I think 101 or 115 of those, or somewhere in that range, were from certificate matching, and the other was from the traditional investigative process that they go through with the county health departments.
So Casey's asking the question, where is this information coming from? And I'm hearing some variations of this question because of the news likely about the CDC and the numbers going straight to the White House instead. So here's what's happening here. These are Arizona numbers. These are reported right here in our state. We're in fact getting them and looking them up before they would have even ever gone to the CDC. So that part of the story doesn't even affect the numbers that we're getting right here. These are, we're going straight to the source to get these numbers, Garrett.
Yeah, these are coming from two different sources that the health department uses, two software packages, if you will. One is called MedSys and the other is called EM Resource. MedSys is sort of the patient tracking system that they're using to track cases and tests. And again, this relationship between MedSys is done with the hospital systems, the county health departments, and the state health departments. So the CDC is not in on that, or the Health and Human Services. They're not in on that chain. And EM Resource is the same thing. EM Resource is a hospitalization a hospital system program where they're reporting numbers directly to the AZDHS. So after, where you're talking about as far as what goes to the White House or the CDC, that happens from the AZDHS onward. So that's sort of outside the chain of what we're looking at.
Yeah, so Casey, hopefully that answered your question there. Garrett, we had a few more questions coming in, but before I get to those, I want to get to some of the hospitalization numbers, because it looks like there is a bit of good news, if you will, there.
Yes, and these are one of the good things about one of the things about hospitalizations is that they do not have the same lag as sort of the other Monday reportings. These are all, hospital reporting is all done in a 24-hour period, so they're much more reliable to be accurate and not, having to catch up with the reporting. And what we had there, I'm just gonna go directly to the COVID-19 specific metrics. Inpatient beds, this is the acute general care beds. As you can see, we were hitting records in the July, last week and the week prior. And we've gone down from, I think it looks like this was the record of 3,517 down to 3,084 in inpatient beds. That's a drop of about 500 in just a very small amount of time. We've also seen a drop in ventilator usage. ICU beds also have seen a drop. It has not been as dramatic, but this one lags a little bit on inpatients, so we're expecting to see a little bit more of a drop here. The discharge also had a drop. And then another important factor is this emergency emergency room visits. Emergency room visits are perhaps the best leading indicator we have on what's going on in COVID-19. And you can see now we've got a trend here from July 7th all the way down to here. We've seen basically 2 weeks of pretty decent drops in emergency room visits. So this is all very good news as far as hospitalization assets are concerned. Just all across the board, hospitalization assets down. Sometimes the total census numbers right here in this hospital bed and usage availability, they're also down slightly, a little bit more slightly on this one. It seems that it's more of a leveling off with the total census, which means there are people going into the hospitals for other reasons as well. But we're still seeing encouraging numbers there as well.
Yeah. Really encouraging. Brittany is asking, is Doug Ducey speaking today? And if so, what time? Brittany, we expect that we will hear from him this week, but there are no plans for him to speak today. Our best guess at this point, he typically talks on a Wednesday. So that might be when we hear from him. It looks like Christoph's asking the same question. Likely midweek. And of course, everybody's waiting for that because he had promised last week that he would speak a bit on education. And if you want to get the very latest on when your schools, lots of these schools are making decisions already. They're not waiting around for the governor. A few more came this weekend. If you want to check on that, that's abc15.com/schools. There is an interactive map right there. You can hover over your area and see exactly what the plans are for that school district or what the proposed plans are, and you'll be able to get to know exactly what that looks like in your area. Do you report on the R0 number? Let's talk about how that is affected or not over a weekend and why that is worth noting, but not as reliable, I guess, if you will.
Yeah, I mean, what I would say with the R0 number on weekends, and we can show it, but I'm just going to talk through sort of the issues that the R0 might have during this time. So the R0 number is very dependent upon what the AZDHS is reporting out. You can see here we're at 0.98 again. We're still under 1, but I need to put that note in there that it's very dependent upon what AZDHS reports out. So when there's variations in the data, like say a Monday, where we know that we know because we have a consistent pattern of tests and cases not coming back and being backlogged on a Monday, that I would just not take as much stock in a calculated R on a Monday as I would maybe on a Tuesday or Wednesday. It's just one of those things that comes with the fact that they're using the reported numbers out. So just know that when you look at this number, that it is always subject to change, but on a Monday to Tuesday to perhaps a Wednesday, it might be even more subject to change.
So, Garrett, it looks like we're getting a larger green section, though. It's so tiny, I know, on people's phones that they're watching on right now. What other states are in that green section with us?
It appears that Connecticut is now in the green section. Washington State is now in the green. And then we have Ohio, Delaware, New Jersey, Utah, South Dakota, and Maine. That's what we have in the green section right now.
All right, and this, just to remind everybody, is about how fast this virus is spreading. So we want to be below a 1, hence those states below a 1 in the green, the states above a 1 in the red right now. Mary Kay's asking, how old is this data? I'm not sure which one she's asking in particular, but we can talk about where there are delays in some of the data, and also where it's up to date, but we can't necessarily trust it as far back as the graph would show.
Yes.
So that what you want to start with to explain?
Yeah, I'll start with how old the data is. In general, most of the data, so hospitalization, anything when we refer to hospitalization resources and assets, that data is not that data is 24 hours old. The bed count happened the day before. Mm-hmm. So we that is the most reliable indicator of what's going on, simply because we know that there is no backlog. Regarding some of the data that we have from AZDHS, what we do know is that there are backlogs happening at AZDHS, and it just depends on what it is. Today, I worked on a calculation. I can't graphically do it yet because I'm not quite done, but I basically am able to estimate now that we are at about a 13-day backlog on tests, just based on how long it takes for the epi curve to fill in. And it seems that we're at about 2 weeks now. It takes about 2 weeks for sort of the bars on the curves to stabilize and not really change from day to day. And that's going to be that number is going to be smaller for deaths. I don't know what the number is quite yet, but it won't be 7 days. It will likely be higher for hospitals, and it will likely be around 13 days for cases as well. That just simply means we're looking at data as far as the competence of what is actually going on with the curve is about 13 days ago.
That's interesting. Did you say it was? How did that fluctuate as we went along for Arizona in this pandemic? Could we trust it 7 days back at one point? Yes.
7 days has been the sort of the general understanding, and it was pretty consistent both in May, June, and early July. In fact, that it was about 7 days, 7 days, 7 days, and then we started hitting those. I can only surmise or presume that it had something to do with those massive testing blitzes that were done, where people were waiting in line 8 hours, and that seemed to have really kind of blocked up the system a little bit. And so now we went from sort of a pretty competent 7-day termination of the average to now 13 days. So and it's just sort of wildly varied right now.
So when things start to level out a little bit, we might see that number then go back up to a 7-day lag.
Yes.
That again.
Yeah. We will see. We'll eventually see that number go to a 7-day lag. I think it will always be a 7-day lag, just simply because it takes X amount of time for certain things to process, 72 hours or so for certain things to process. So I think having a 7-day lag on the average is probably one of the best we're going to have, but 13 days is pretty bad. Let me sort of see if I can show you what this looks like. If you just want to give me a moment, I will render.
Yeah, it's if you've served on a jury in the past couple of years, when you get picked to be on it, they'll say, this is not like the movies, this is not like TV, we're not going to solve this in one episode, and they kind of reset our thinking because we're so used to having everything in this life now be instant, and that's just not the case. And that's the same with this data as well. We can only go back so far to say this is as far as we can trust this. This is as far at this point that we can say, all right, let's look at this, and we can actually read this correctly and safely.
So you can see this is the case epi curve for Arizona, and the yellow line is my 7-day rolling average. And you can see we hit a peak on this about 3 weeks ago. and then you see it sort of craters. I mean, it just drops like a rock. And what you see in this light blue is cases still being filled in. And you can see these last 3 days, which was only this is about 13 days from ago, they're still being filled in by a large amount. I haven't changed this graph yet, so this one still has the 7-day rolling average dropping at 7 days. But now I'm going to show you the cases. This is what the cases look like when the 7-day average gets recalculated to reflect the stability. And so you can see that drop is still there. We're still at a peak from about 4 weeks ago, but it's no longer as dramatic, simply because we still have to take into account what's going to happen with this last week right here. There's still a lot of cases or tests being missed. I mean, if you look at how this stepping goes, it's very consistent from week to week. And then all of a sudden we get to this last week and the consistency just drops completely. It makes no sense. So eventually this is going to look a little more like one of these curves. I presume it's still going to be going down. I don't know yet. I don't know what's going to happen with the curves, but I just know that right now there's consistency missing.
Yeah. Melissa's writing, you're creating panic doing this daily. Melissa, this is what we hope to do here, is to inform so that you can make the best decisions for your life. We don't want you to be panicked. We want you to be calm and confident that you're reading these charts correctly, and that you can make sense of this so you can make the best decisions for your life. We need a data analyst to help us understand this. And we're so lucky that our bosses see this as important enough that they've hired Garrett on. Garrett, you actually were hired before this pandemic started and help us make sense and give depth to our reporting in all areas. Garrett, talk about some of the things that you were working on before you and I got thrown into the pandemic issue. I mean, you were pulling numbers on anything, whether it was crime related, any statistics, that is your field.
Yeah, I was working on crime. I was working on opioid data set. I was working on politics. That's where I come from as an elections analyst. That's my first foray into statistics. But I was pulling anything. And anytime anybody needed anything about that had something to do with numbers, I would help them find it and make sense of the numbers. Now, of course, with COVID, it's pretty much a daily thing now that I'm just focusing on these data sets at this point.
Yeah. So Melissa, if there's any numbers we can help you find in here, we're happy to help do that. We just want to educate and inform people on this stuff. We look at these charts all day. Garrett especially looks at these all day. So we can help you find the information that you need so that you can understand this even better and make the best choices for your life. So it is never, ever to create panic. Both Garrett and I have lived here for a very long time, and we're invested in this community and making sure that people are safe. So that's what we hope to answer here. All right, Amber asks, how so? They are showing where to find the data. Oh, thank you. Thank you, Amber, saying how is that creating panic? I would much rather know where to find the data so I can make decisions. Thank you, Amber. That's exactly why we do this. We are just here to teach, just here to help you find where it is. So if there's something specific that you thought, this would be my metric for knowing if I felt comfortable going back to the gym or comfortable sending my kids to school. That's when we're hearing a lot right now from parents, Garrett, is my child's school has been decided and we already know. So we're not waiting on anything from the governor. We happen to be one of the school districts that made a pretty strong decision early on about what to do. So, but I know a lot of people are waiting for that, and they're watching different metrics very closely. And it was interesting, Garrett. I don't know. I know you watched the governor's news conference last week, but he made a chart of maybe three or four metrics that he was watching, and boy, do you know, it's the ones we had been talking about so much, the R0 and the percent of positive tests and how it's split into week. How were those looking week to week to week? I want to tell everybody you can find those on the Arizona Department of Health site. There's a percentage up higher that you can get a little bit lost in because the number is of the whole pandemic. That doesn't give you an accurate picture of where we are right now. Although it's interesting to see where we were from February to July. We need a snapshot. We need a peek of what this looks like right now. And I see Garrett darkening his screen based on requests coming in that it's even easier to see. Garrett, you're here to please. Thank you for that, yes. Sir. How did the numbers look week by week?
Yes, so we're gonna look here for the first thing you gotta do is you go to laboratory testing. And then you go down to PCR, because you really want to look at what these numbers look like as far as PCR. You can see 4.5%. that did not change from day to day yesterday. But really, we want to focus on this curve. This is what Katie is talking about, these bars and these dots. So, but here you can see how to read this chart is 11 tests were conducted the week of July 19th onward, and 18% have come back positive. Now, obviously, that's not a very useful metric with only 11 tests. So we go back another day. 35,000 tests were conducted the week of July 12th, and of those, 16% have come back. That's fairly encouraging because that's a larger number. So we want to keep seeing that stay at 16% and not increase. Now, here's another one, 84,000 tests, and this one's at an 18% positive. And then here in this one, this is our peak, 109,000 tests on June 28th, and you can see that's at a 21% positive. Now, what we were talking about, you can see the lag in here too, or the potential lag. Unless we have been significantly reducing the number of tests that we have been conducting, we should at some point get 84,000, should get close to 109,000. So that's about 20,000. And there's right here, there's another 35,000. There could be anywhere from 30 to 60,000 tests that we still haven't gotten in the system yet.
Garrett, I'm getting a lot of questions in that I want to get to. First of all, Elise writes, how are people testing positive when they didn't even take the test? So far as we know, in Arizona, that is nothing more than an internet rumor. We have tracked, I have personally asked for person after person to call, and it is a game of telephone. Every person that is reaching out to me says, it happened to my friends, it happened to my coworkers, it happened to my parents' friends. We have not found one case of that here. It doesn't mean that it's not happening anywhere. It means that we cannot track that person. If you know somebody that's happened to, let us know. Have them reach out to ABC 15. But there have been, so far, that is just an internet rumor. We have not gotten anyone in that actually can prove that this happened to them. It's always somebody's friend from work or friend of a friend of a friend. So, so we are seeing those reports, but literally not one substantiated case here. We had another question about, let's see. I believe it was Henry, just wrote a minute ago. So 1 minute hospitals are full, the next minute they're not. It varies. People are released from the hospital day to day. So Henry, we're getting these numbers in on a bit of, at some point, a 24-hour lag. So yes, if people are hopefully discharged, but sadly it could be people passing away too. So what is the percentage of in use that we're at here?
Yeah, and really, I mean, the hospitals have not, the hospitals being full or not hasn't really changed. It's been fairly level, as you can see here, really since June 24th. So right. For this entire month, essentially, the month of June to where we are right now, hospital levels have sort of remained stable at that sort of 88 to 87, 91%. And even the ICU reflects that as well. That was ICU, my apologies. And you can see the same thing with inpatient, 85%, and then here at 86%. So really the hospitals, their level hasn't changed that much. The difference was, of course, these hospital COVID-19 specific metrics, which require, I know that hospitals had COVID-19 floors. There's a different sort of care management that they do with COVID-19 patients. And so you can see, just based on this is a ratcheting up, a pretty aggressive ratcheting up of COVID-19 patients that the hospitals were experiencing. So now we're at a point where, at least based on these metrics, those numbers are starting to go down.
Yeah, so I wanted to help Henry see that one more time so that he could get a peek at it. So please don't think that the hospitals are in great shape. We want to take a moment and remember that these frontline workers are working their tails off. Some of them have gone to New York to volunteer when New York was getting hit hard, and then they came back to Arizona and worked just as hard here for all of us. I can't even imagine thinking that you're going to go away and just work around the clock and then come back to Arizona and have it be a bit of a step back and come back to Arizona and only be seeing the same things you've just been experiencing and have to continue that marathon and continue helping and really working around the clock to keep everybody safe, and the emotional toll that you take as well when you're agreeing to work in a COVID unit. Some of the doctors and nurses we talked to said, we never let anybody die alone. We always try to have somebody in there with them. Cannot even imagine that as a job. So we pause just to say thank you to our frontline workers who are doing this inside the hospitals. Yeah, Stephen's saying, yes, they are extremely overworked. All right, David Gibson, why isn't anyone reporting on recovery rates? All right, we can. Well, we can to a point. Let me put it this way, David. There's no agreed upon definition of recovery. What recovery will look like for a 15-year-old is going to look different than a 50-year-old, is going to look different than an 85-year-old. So the best number we have at this point is coming from covidtracking.com, and that has us at about 18,149. Now, David, that is in relation to hospital discharge numbers. And Garrett's pulling this site up so you can get a better look at it. So you can check it for yourself each day. It treks up a couple hundred each day or so, and it's at 18,149, as I just mentioned right there. So you can see that that's the best metric, David, that we have at this point. So many people ask that. There's just no agreed upon definition at this point. Also, imagine how our resources are just being taxed to get testing sites going and try to get contact tracing going. So they're telling all these people that are necessarily sick at home and recovering at home to say, are you feeling better? Are you hitting all these marks 1, 2, 3, 4 so that we can check the box as a recovery? Yeah, Diana's asking how many recover at home. There's no tracking of that just yet. So this is the best number that we have.
Yeah, so we have, as we've talked, we have 145,000 cases cumulative in Arizona, and this is since the very beginning. A good majority of these came from people 45 and under, and a good portion of these are likely already recovered. In fact, I wouldn't be surprised if we were giving a recovery number, that it would be somewhere, it would be like 40% of that 145,000 at this point, because a lot of times some of the counties do this. They do, it's either a 14-day recovery and then they mark you as recovered, or it's a 27-day recovery. And instead, we do have some recovery numbers. We have recovery numbers from the Navajo Nation. They're actually over 50% of their cases are now marked recovery, and that is the case with some of these other places. But it's just, without Maricopa and Pima County giving us a recovery number, there's no way to estimate a true recovery number for the state, because it would be wrong without Maricopa and Pima, and Maricopa and Pima do not give us a recovery number.
Yeah. So hopefully, Diana, that answers your question. That's a question that we get a lot, and it deserves a longer explanation like we've just given, that we can't always give within a newscast that's 25 minutes long. Margaret's asking, are these numbers accurate since the White House blocked access? Okay, so what we were just saying before is we're circumventing that. We're getting those numbers straight from the state. So we're not waiting for them to be reported to the state, then reported to the CDC. We're not playing the telephone game. We're going straight to the numbers. So yes, they're accurate right from the state. So Margaret, thank you for that question. Wow, Amber's saying one friend's been in ICU for 12 days, another for 7 weeks. Yeah, this can be a long fight for folks. So that's another reason why the recovery numbers are hard to track. We have what's called a term called long haulers, and those are people who are sick for an extended period of time, where they're really in this fight to get better, and they're just they might make progress, they might feel sick again. It's just they're in this fight for a long time. So it's another reason why recovery numbers are so hard to track. Garrett, any of the other numbers and data that you want to get to today before we start getting close to wrapping up for the day?
Yeah, I will share, because especially from this weekend, the one thing I wanted to bring out, and I'll share the screen right now, is we had, when we talked about that 147-day report, on Saturday, we had 147 deaths reported, and that was done with certificate matching. Well, then on Sunday, something else occurred. They basically changed, they rolled back a lot of these deaths, and not just these deaths, but other deaths. So this is, as you can see on this curve, same sort of process with the case curve. Light blue meaning added, and this is from yesterday. So added yesterday, and then blue was previous. And you can see under here, under the 0 of the y-axis, you can see sitting here with right here, 1 subtracted. This is probably 2 or 3. All of these together amount to about 47, 49 deaths that were actually removed from the curve over on Sunday over the course of the entire pandemic. So we still have not received a word from AZDHS as to what could have happened there. We're still waiting on sort of clarification as to why those 47 deaths were removed.
Yeah, we'll pass that along as soon as we hear anything more. All right. Let's see. We just heard from some of the people working on the front lines, and I want to get back to that. Let's see. Jen Smith made a comment just a few minutes ago, trying to read these as fast as we can. Let's see. Jen Smith there. As an RN nurse in the West Valley, in a West Valley hospital, we are not slowing down, getting busier and with less staff due to illness and burnout. Yes, exactly. Those two factors there. Our frontline workers getting sick and also emotionally worn out. So some of what we were just discussing earlier. So let's see.
And that's, you know, I just wanted to point something out to go with what Jen just said. So the numbers that we show on the hospitalizations, those are statewide numbers. So what we could be seeing, as Jen said, she's saying she's a registered nurse, she's still busy, everything's going on there. That is a snapshot of the entire state. That could be accounting for drops in Yuma Regional Medical Center up north in Flagstaff, and that's, you know, we're seeing higher than normal drops in certain parts of the state that we're not seeing in others. So it is absolutely plausible that we see these really rosy numbers, and yet there are still some parts of the state, especially in the West Valley, where we know that the pandemic is kind of hit really hard. That there's still, those areas are still, you know, ramping up and still having problems, and then maybe some other areas of the state we're seeing some slowing.
Yeah, they can still be slammed. Debbie writes, thank you for explaining about the removal of deaths, Garrett. Steve mentioned that on the news last night, and I wasn't sure what he meant. So hopefully that was a longer explanation. Sometimes on newscasts, we have to boil something down to just, you know, one quick sentence when we're trying to cover all the topics. And so, Debbie, we're happy to clear that up for you. Thank you. AJ writes, when are the gyms going to reopen? AJ, at this point, they are closed until July 27th. We do expect the governor to I would say, address something on this because we're getting so close to that date in his next news conference. And we're expecting that likely midweek, probably on Wednesday, usually is when we hear from him. So that is the latest date, but it seems like there's success in mitigating these numbers with the gyms and the bars and those things closed. That came out a couple of weeks ago. Garrett, we had the mask requirement come in not too long ago for Maricopa County, and then also the gyms and bars. And so it seems as if some of these new measures are working.
Yes, and in fact, we've had, if you look at some mobility data, we've seen that, you know, like we have seen a gradual slowdown in mobility of Arizonans as well. So, you know, place opened back up in May. It started to pop right after Memorial Day. And then we started seeing this sort of, especially at the end of June, we started to see a gradual slowdown of mobility. So people are, even though we don't have any sort of shelter in place order or anything, people are just making the decision, you know what, it's probably best if I just stay home right now. And that's starting to happen sort of organically as well.
Yeah. Do we have, we're getting some questions about the size of crowds. Do we still have that website where they were tracking the size of the groups, and we could, was it Virginia Tech that did it?
Georgia Tech.
Georgia Tech?
Yeah,
okay.
Let me pull it up.
Yeah, because I just got a question. I'll scroll back to the question. Arthur asks, how is going to a gym, the small crowd, more dangerous than going to a grocery store where thousands of people are touching all the same items, breathing the same air? So a lot of times at the gym, they weren't required to wear masks, and now we're seeing masks being required in the grocery store, in Costco. Most of these major chains are now asking everybody who's coming in to be masked. And then obviously we hope you wash the items when you get home, fruits and veggies and things like that. But this this page really helps, Garrett, because we can sort of apply Arthur's question to it by choosing what size crowd we want to see would have the spread. So we want to see how many people might be infected in a crowd of a certain size, and we can do that on that slide bar on the side and choose our location.
Yes. So we can see I've gone down to Arizona, and this is using modeling techniques. So this is using what a modeling forecast of how many people, not just people who have positive cases, but really what the infection rate looks like outside of that, you know, the whatever it is, 800,000 people or so in Arizona that have an infection. This says that in a crowd of 100 people, that there's over 99% chance essentially that at least one of those people have COVID-19, have an active infection. And we can bring that down to 25, and it recalculates everything. And you can see at a size of 25, it says, okay, there's about an 87% chance that in the Maricopa County area that a person would have COVID with a group of 25, 10. And then here we are with 10, and we can see that's 55%. And there's other areas, 18% for Yavapai. So it says there's it's basically saying there's very high chance that no one has even any sort of infection in Yavapai County in a group of 10.
Garrett, thank you. Wayne asks, you should be reporting on the number of missing kids instead of this. Wayne, you can find that story right now on abc15.com. We actually did that story as well earlier in the week. It ran on Friday, and you'll be able to find it there, missing kids in Arizona and exactly who's looking for them. So this particular chat is just about the data and the numbers behind coronavirus. So we help people to find the data and the numbers on the internet or other places that are easy for them to access without having to request specific records or write a letter or go downtown or do anything like that. Let's have it at your fingertips, show you where to find it, and help you to make the best choices for your life and your family. We don't want to do that for you. We want to show you and teach you where the numbers are so that you can find them each morning or each day, as so many people get ready to make decisions about sending their kids and their grandkids back to school. So that's what we want to help you with right here. Let's see. We just have a few more minutes left. Oh, when is, oh, let me get to this one. I see two questions coming up. Lee's writing, hi guys, I joined late. Are we going in the right direction? Let's put it this way. We're in a better situation this week than we were a couple of weeks ago. We're seeing the climbing happen less, if you will, but it's nothing to celebrate just yet. We got to kind of hold steady here and keep doing what we're doing. So Lee, thanks for joining us. Let's see. Kimberly asks, when is Dr. Ducey expected to make school opening decisions? We're expecting that to come in this next news conference coming up midweek. We hoped we would get something last week, and I know so many people were waiting on that word and it just didn't come. He did say he will address it in the next news conference that he has. So yeah, so Debbie's asking, will he speak on Wednesday or Thursday? We don't know at this point. As soon as we know, we'll pass it along to you. But usually, Debbie, it's in the midweek. We're getting some requests go by about the Navajo Nation. Can we check on?
Yeah, yep, I pulled it up. So I don't have any graphs on the Navajo Nation, but what I can tell you is I have been tracking this since the very beginning. Today, the Navajo Nation had 25 new cases. There were 7 deaths today, likely because of weekend reporting there. And so what their totals look like right now, they have about 8,593 cases. That's their cumulative. 6,360, so about 6,360 of those are considered recovered, and 422 deaths. So they, for the most part, the growth in the Navajo Nation has been under 1% every single day for several weeks, like almost 2 months now. They've had some days where it's sort of spiked. They have not had a growth of over 2% since, let's see, I'm trying to find it right now on my sheet, and it's up there. It is June 11th was the last time the Navajo Nation had a growth of over 2% in one day. So as far as the size of the infection growth there, it has slowed considerably in the last month or so.
Yeah, and they've also had a very aggressive handling of this shutting down for 57 hours at a time on the weekends. So a lot of times when we're finishing our 6 o'clock newscast on a Friday night, they're just getting ready for around 8 o'clock to shut down. And they're shut down fully until Monday morning. It means get your groceries, get your gas before this all shuts down, because they're closing everything at this point. Let's see, any other things to touch on before we sort of wrap up for the day? We keep getting a bunch of new questions that I want to get to. So
the only other thing I would touch on is, because it's a Monday morning, we do have what's called the COVID-like illness data back in 8 updates on Sundays. And so that is in this right here. This is a surveillance system run by the CDC that all the systems run into. And to just go back to that, this is not a data point that would ever change hands to the Health and Human Services of the White House. This is a surveillance system that has gone on for influenza for a long time. So this isn't going anywhere. But this number right here, you can see we had a peak of inpatient on that week of 20.9% of the inpatient visits to hospital that week were considered COVID-like illness. And here we have one at 18.4 the week after, and then this has been recalculated right now to 12.8. So that's some very encouraging drops. When we reopen the state, we were right here, I believe, at this 5.5 to 5.0 number. And so we were just not registering that many hospitalizations through the surveillance system in the in the hospitals. And then, as you can see, as June and July came around, it just ramped up pretty crazy. So we're hoping this it recalculates every Sunday. So we don't know if this isn't something that's going to change. It could change. It could change again. All of these weeks could change. It usually, things with CDC and that sort of data usually takes about a month to stabilize.
Yeah, some people were asking if Arizona's going to shut down again. We have no indication that is in the plans or in the works at all. So we just wanted to stress that. Doesn't mean that it couldn't happen, but we have not heard anything from the governor's office like that. Let's see, time for a few more questions. I know we always get some of the best questions right here at the end. So I want to make sure we get to everybody's here today. Let's see. Oh, they were asking about a stimulus check. We only have information on data is what we're tracking here, data and numbers. So while I wish we were tracking the money numbers too, that's something we will cover in our newscast at 4, 5, 6, and 10 p.m. But right here, we're just looking at the Arizona numbers. Oh, Viola is asking, when are they closing everything? We just don't have any information on them closing anything down at this point. It seems like they would be confident in what's working here, Garrett, because we are seeing some success in these changes so far.
Yeah, I would imagine that too. I mean, unless they're looking at data that's different, or and again, an epidemiologist could tell them, or someone could say, this test backlog is a concern, and if you look at these, things are changing. I just don't know. But as far as the hospitalization assets, what we can see is those resources have leveled off or are going down. And I know that that was a big point in Doug Ducey closing the state, was to level off these hospitalizations. So that's sort of where at least if I was trying to get into his mind, that's what I would think. I'm kind of with you that I don't see him closing down the state when things are going down like this.
Yeah. Yasmin writes, thank you for the good news reports for today. Thank you. You're welcome. We're happy to finally see some things sort of either plateauing or trending down a little bit. It obviously makes us feel safer, and also it's easier to report some better news than it is the troubling news. So so how are we doing on mask wearing? Rick writes, Rick, if we're seeing these numbers go down, it seems like that it's working at this point. Love your pictures there, by the way. The two photos are Rick with his mask on there. So it seems like so far it is working. That's what we're seeing reflected in the numbers here, when a couple of weeks ago that was implemented. All right, I think that kind of wraps us up for today, Garrett, unless there's any final things that you wanted to touch on.
No, just remember that today's Monday, so tomorrow being Tuesday, we just the way it works, we could be looking at a very different day tomorrow. So that's just the way that reporting works when it comes to COVID-19. So
yeah, Tuesdays have definitely been tough. So we want to brace everybody for that. Hey, one quick last question. Matthew's asking, where are the numbers for people under 20? Matthew, if you're in Maricopa County, you can get even more specific numbers. We don't know that you are, so we can just show them the state numbers. But on the Arizona Department of Health website, you'll be able to break that down by demographics, as well as on the Maricopa County site, you will be able to break that down by age group as well. So there it is. Was it at 14,000, 16,000 now? Okay.
16,500.
So that's the place to find it. Matthew, hopefully we didn't go too fast, but right there on that AZDHS site, and then click on the demographics button that Garrett's circling there for you, and you'll be able to find it each and every day right there, and a breakdown of how all
just on deaths and hospitalizations as well.
Perfect. All right, I think we'll wrap it up there. Thanks to everyone for joining us on here. We appreciate all of you taking time out of your day to help better understand the numbers, and hopefully we were able to do that for you. If you have questions for us, we'll be here tomorrow at about the same time. Remember, Tuesdays are tough, so we'll carefully walk you through all of those numbers. And then if you'd like to find me, I'm on Facebook at facebook.com/news from Katie. I know some people, well, obviously you're watching on Facebook right now, so you'll be able to join us there easily. But if you're a Twitter person as well, you can find Garrett at twitter.com is it / when you're on there? Twitter.com / your handle. There you go. At Garrett_Archer. And mine is at Katie Ramel. Two of the easiest places to catch up with us. So Tomorrow, we'll be back with you answering even more questions. And remember, the very latest information can be found at abc15.com/coronavirus, or catch us on our newscast at 4, 5, 6, and 10 p.m.